So let's start our session with the clitoris. We all know the clitoris is not a very small organ. This is female primary sexual organ which is present. And we can see the glands of the clitoris which is hidden into the clitoral hood here. So these are the approximate location, the labia minora, that they both are joining with each other on the top. They are creating a clitoral hood. Into this clitoral hood, these clitoral glands of the clitoris can be visible, and we can palpate that and we can see that. But it's not only this is the size of the clitoris. Clitoris is quite bigger than that. So this is only this gland is visible here. The whole clitoris is hidden inside the body. And the clitoris is having different parts. So we can see that clitoris is homologous to male penis. If you just see the differentiation between male and female sexual organ, so they have a big body and they have a smaller legs. But in our case, in a female body, we have a small body as compared to male, and we have a larger legs. And they're forming the structures, and they're all together, like you can see, glands which is visible hidden into the clitoral hood, and then they will go towards the pubic symphysis, and they are going to turn down sides. They will form a root, and from the root we have this bulb of vestibule is coming. That's a big gland. So again, this is forming the whole clitoral structure. There's a part of clitoral structure, and the clitoris is going to go split it into two halves, right and left clitoral legs. So this is the clitoris like this, and they're going to split into two parts. So this is like our organ, and there's one important ligament which is supporting the clitoris and joining it with the pubic symphysis. So downward part of the pubic symphysis. Yesterday we understood that there are inferior tubercle of the pubic symphysis over here. So mid of the and this is a connective tissue. So mid of this connective tissue, inferiorly, this clitoris is attached with the pubic symphysis. And this picture is very, very visible into this image. So you can see this is the glands of the clitoris. This is the clitoral hood, glands of the clitoris, body of the clitoris, suspensory ligament, just joining that with the pubic symphysis, the central part. And then they're going to split into the legs. And the legs are quite long, and they are following all the way up to the pubic rami. And during the sexual arousal, the legs of the clitoris can go for erection. And from the root, we have this one structure which is coming, that is the bulb of vestibule, a sponge-like gland which is present there. So what we will see in a female body, there will be cluster of hair. If you remove the hair, then we can see the visibility of the skin. Assume that we are removing the skin. If we remove the skin, then there will be the superficial pelvic floor muscles. The one layer of the pelvic floor muscle will be present here. And like this layer, let me show you this layer. These layers. So this is after skin, we will have this layer of the pelvic floor, superficial layer. And the name of this muscle is bulbocavernosus muscle. And the sides following the pubic symphysis and pubic rami, we have this another muscle of pelvic floor. So this is ischiocavernosus muscle, because they are formed for following the ischial area. They're coming from the ischium. Okay, so this is ischiocavernosus, and we have a bulbocavernosus. Bulbo means the muscle which is on the top of the bulb of vestibule. Bulbocavernosus. So the muscle is coming and going towards the caves. So there are two caves present. You can assume that one is a downward is a vaginal cave, and upside we have a urethral cave. So they are forming a kind of passage. So the name of the muscle is bulbocavernosus and ischiocavernosus. And this muscle will again wrap within a very thin layer of the fascia, which is going to wrap around these muscles. Okay, so and if you so first was the hair, then the skin, then the pelvic floor muscle superficial layer, and after removing the superficial layer of the pelvic floor, now we can see glands of this structure down there. These structures which is present. Okay, And if you remove that structure also, beneath this structure, there will be middle layer of the pelvic floor. So these glands of clitoris and the clitoris and the bulb of clitoris, bulb of vestibule, they both are squeezed between superficial and the middle layer. This is a beautiful picture. Now, I want to take you through this. Clitoral hood is a covering of glands and formed by the two sides of connecting labia minora. So that's the extension of the labia minora erectile tissue. So the clitoral hood is going to go for erection or going to go for movement whenever female is going to have sexual arousal or activities. Second is the glands of clitoris. It's a P-shaped area, this area. It is most highly innervated area of the clitoris. It's extremely sensitive to touch, and many, like millions of nerve endings are present around this region. And unlike the rest of the clitoris, the glands does not swell or grow during the sexual response. Now, this particular small P-shaped area don't have erectile tissue. They have more sensitive tissues, which is going to send this sensation to the brain. So those kind of structures and hormonal receptors are present around this region, but they are not going to go for erection. Then we have a body of the clitoris, this body, and the body is connected to the glans clitoris and is projected upward towards the pubic symphysis and attached with the pubic bone via ligament, suspensory ligament. So this is the ligament. So sometimes your patient can show you the pain. And if she's showing you, just be with me, girls. Just a minute. Huh? All right. So this particular body of the clitoris is going to the suspensory ligament with pubic bone. Some females can complain sometimes that they have some kind of deeper pain around the pubic symphysis. And they might also tell you that during sexual arousal stage, whenever they are into the sexual activity, they have some kind of pain around the pubic area, pubic region. So they might be because of some trigger points present into these pelvic floor muscles. And we have another thing like this round ligament is also coming from the uterus. So altogether, suspensory ligament pain, round ligament pain can give pain during the sex. So we should always keep that in our mind also, that female might have some kind of problem with the suspensory ligament, and that can cause a pain to the pubic symphysis. So if this ligament pain is present around the pubic symphysis, so we can apply, we can apply cryotherapy or some kind of hot packs. You can also apply IRR over the pubic symphysis. So that is going to release the tension which is going on into the region. You can apply ultrasound, therapeutic ultrasound with the, like 3 megahertz you can use because the superficial area involved. So you can apply ultrasound, we can apply cryotherapy, we can apply IRR, or if you found on the palpation some kind of tight bands or trigger points, we can even use some kind of mobilization technique like ischemic compression or pressing the area with the pressure for 45 seconds, 30 seconds till the time patient is able to feel that. So that can also help a female in releasing the tension, and give your patient some exercises which helps in relaxing the region and giving this, like creating the stretching. Hip extension exercises are hip extension and lateral rotators will be good in those cases. Lateral rotation of the hip. So hip extension and lateral rotation will be good for the patient. External rotation of the hip will be advisable in those cases. So still we will have more discussion about this round ligament pain and suspensory ligament pain in our further sessions, like when we discuss about the puberty, because that is going to give problem to that region. But yes, not only the puberty, sometimes the female who are doing this lot of bicycle riding, they might have pain around this region. Another is crura of the clitoris. Crura means, we can also say it's the legs of the clitoris, and so there are two legs and they are extended. Our clitoris is split into two parts. And the reason behind that why our sexual organ has to split is because we have an extra orifice in our body, vagina and urethra. As a male can urinate and ejaculate from the penis. So there's no problem. But we as a females, we have a different organ for different functioning. We collect urine in the bladder and we void through urethra, and we have our uterus, and every month into the uterus endometrial wall is forming, and that wall is going to shed through the vagina. So we cannot mix the blood and the urine. So that's why, and the baby is also going to develop into the uterus, and baby is going to go out into the world. So we have a different openings for these two organs. So that's why our sexual organ has to split into two parts. Our body, even the associated structures like this sponge is also separated into two parts. And our bulbocavernosus is also separated into two parts because we have two different openings. So these are the legs of the clitoris, and the legs of the clitoris is erectile into nature. So whenever we are aroused, so our legs goes for erection. So more erection happens into the legs, and that is going to be that they can extend up to the all the way, around the ischial tuberosities. So we have a space. So erection happens in all the direction, superiorly, downwards, inferiorly, and as well as everywhere it happens actually. So like diameter is going to increase when the female is aroused. This is a real cadaver picture. You can appreciate that this is our pubic symphysis, and we have this pubic rami going on, and we can palpate the ischial tuberosity. Okay, and this is our structure. This is only this much is palpable, and completely everything is hidden beneath the muscles. And we have this body through the root. We have this structure, bulb of vestibule, and right and left bulb of vestibule, and then we are having this legs of the clitoris. And just between the bulb of vestibule, the urethral opening is present, and downward, this is the vaginal opening. So this is the vagina, which is a collapsed vagina. So anterior and posterior wall of the vagina are joining with each other, okay, and they are downward, fallen, because this is a cadaver. The vagina is not active vagina at that time. And we can understand this is whole perineal body, and many nerves are gonna go towards that. These are the dorsal nerves of the, this pudendal nerve actually. Dorsal branches of the pudendal nerve, which is going on upside towards the clitoris. So pudendal nerve, upper branch. So there are three branches of the pudendal nerve. One supplies that anorectal region, one supplies the perineal region, and one supplies the clitoral region. So these are the dorsal nerves of the clitoris, which is making the clitoris more sensitive. And this is also a good picture where we can understand that many nerves are ending into the clitoris, which is making our clitoris more sensitive. Okay. And there's the branches of, you can say, the internal pudendal vessels are also coming, veins, nerves, everything is coming to this region. So yes, we can, this is another picture. The scan, you can see that this is a scan, and this is pubic rami, and into the pubic rami, these are the legs of the clitoris. Okay, all the way, these are the legs of the clitoris. And they're going up and they're coming down, and this is the protrusion, and we can see the glands like this. Okay. Another, this is again another beautiful picture where we can appreciate. This is the glands of the clitoris, this is the body of the clitoris, and on the sides is going on the legs of the clitoris by encircling on either sides of this. What is this? This is the urethra. So this is a bladder of a female, which is collapsed bladder, and the bladder is having this urethra. And now we have this uterus. So the female is having a retroverted uterus. This particular female is having a retroverted uterus. This is the cervix of the uterus. And then this is a vaginal canal. And now this urethral opening is present, opening into the vestibular area, as well as the vaginal opening is also present into the vestibular area. And both sides of these canals, this is gonna go are legs of the clitoris. Now there's another beautiful picture which you can see here, this one. Look, this is the beautiful encircling of our clitoral network. So clitoral network means what? The clitoris with the vestibular gland. Okay, these two are forming the clitoral network. And this clitoral network is encircling the urethra of the bladder and the vagina of the this vaginal passage. So both side and the legs of the clitoris and body vestibule is gonna be on the same level of the vagina. So either side of the vagina, this this structure is present, extending. And this is from the side you can see, and this is from the front we can view. So assume that this is our female and the organs are lying inside. This is the uterus, this is the bladder, and then we have a pubic symphysis over here. We have a suspensory ligament, which is holding the clitoris. And this is the body, glands, and on the top we will have, let me make one clitoral hood. And then there will be one, like you can see the labia minora going downwards. And then on the sides, there will be labia majora. And there will be pubic rami on the sides and pubic symphysis is upside. So this is how this you can understand into vestibule, urethral opening and the vaginal opening is visible. Okay, I hope you all are clear about this. And just beneath this glands of the this bulb of the vestibule, we have a small gland. Bartholin gland is also present. And from the Bartholin gland, we have an opening of the Bartholin gland on either side of the vagina. And we have two small opening here from the vestibule. So this is how beautifully our structures are present and we should be able to understand. So yeah, this is the picture, urethra, vagina, this is the bulb of vestibule, legs of clitoris, body of the clitoris. I think you understood now. Clitoral urethral vagina complex, we can say that. So this is how beautifully our sexual organ is encircling our vagina as well as the urethra, our canals. And we can come outside and view that externally. We have a urethra inside, and we know that our urethra is like small. It's 4 centimeter long and 6 mm into width, homologous to prostatic urethra, male urethra, and it opens into the vestibular region outside here. Now, beneath the urethra, we have another canal, another opening is present, that is urethral opening. We also we also name it as a vaginal introitus or vaginal orifice. So there can be 3 names: vaginal opening, vaginal introitus, vaginal opening orifice, and they are located into the vestibular area. And as we already saw in this image, that they always remains into closed state. Look, it's closed. The anterior wall and the posterior wall of the vagina is joining with each other. And yes, yeah, this is also, I want to make you understand, this is a flaccid clitoris and this is the erected clitoris. Okay, so erection happens, so our clitoris looks like that. And when we are not right now, our clitoris is like flaccid like this. So physiology of clitoral erection. What happens during the erection? Upon sexual stimulation of the female, increase in blood supply towards this particular clitoral structure because of these clitoral arteries, they fills the sinusoids contained into the corpora cavernosas. So this is our structure, clitoris. If you just see the clitoris into the cross-sectional view, so our clitoris is something like this. And into this particular clitoris, if you zoom out, zoom in actually, so you will feel this kind of cavernosas are present internally. This kind of cavernosas, few small opening. And these openings are gonna be filled up with the blood. When lot of blood will come during the sexual arousal, so blood will come here and they will start filling the blood inside. And into our veins, there will be release of the release of the nitrous oxide in our body, which is gonna stop the draining of the blood towards the heart. So venous draining will be preventing, and blood will accumulate there, stay there for some time, and erection, and the blood will be there. It's like a balloon. The arteries will expand, and it will show expansion and like erections, that kind of structure, more aroused structure, more filled cavernosas. So the increase in clitoral blood supply is a result of arterial vasodilation and smooth muscle relaxation. Whenever we are going to have this sexual intimacy or stimulations, at that time, our body, this whole structure is already relaxed. The smooth muscle is going to go for a lot of relaxation, and the corpus cavernosas will relax, and the filling will start. The blood filling will start into this region, and the blood will gonna give this kind of erection to the structures, and we can see the erected clitoris. We can feel the erected clitoris inside. All right. And let's go to vaginal opening. So if this is a vaginal opening, and depending upon what stage of our life we are in, what is the age of a female. If the female is very young, around 13, 14, 15, 16, very young female she is. So there might be possibility that vaginal openings are not open. So there is a thin flap might be present here. And that particular thin flap, where the tissue of the skin, which is gonna cover the vagina, because the body don't want any pathogen bacteria go inside and do infection, create infection into the vagina, into the cervix, or inside the uterus. So just to prevent the infections inside or pathogens inside our sensitive region, our body is having a thin covering of the skin before the puberty. But after puberty, when we are going to have the periods, the thin skin is going to dissolve slowly. So this particular thin skin, we name it as the hymen. So we are going to discuss about the hymen now. Hymen. So hymen is a thin superficial layer of mucosal tissue that stretches across the opening of the vagina. Usually there is room enough. So if this is a vaginal cavity, vaginal length, vaginal canal, so long vaginal canal. So into this long vaginal canal, the outer side, just on the door, assume that you have a door of your house. In that door, you have a curtain, one extra curtain. So this hymen is like an extra curtain which is present around the door. So nothing should go inside the vagina and create an infection to vagina or our reproductive system. Vagina, cervix, uterus, fallopian tubes. We don't want that. And body wants to do this safety inside. Okay, so it is a protective layer. So this is approximately location where our hymen is present. So some females, once will open the vestibule. So if you open the vestibule, we will not see opening into the vagina. So some tissues is present. Okay, so this particular tissue can be the hymen. But the tissue which is present here is not completely closed. So it's not something like complete close like that. So you can see here, this is the vestibule of a female, vestibule, and this is labia minora, fold, right and left. This is the clitoral hood, and over there we will have a clitoral glands. So in this opening, if you can see this is the urethral opening. So this is visible, urethral opening is present, but there's no other opening is present here. And it's completely closed. You can't see any other opening. Sometimes there might be very small hole like that. The opening is having a hole. So this whole tissue, whole skin, we are calling it as a hymen. Hymen tissue is present. But not all, like vaginas are not like that. Hymen tissue is not present like this after the puberty time period. Puberty is a time when this tissue has to shed out. They have to create openings, because if openings will not be formed, like this kind of openings we really need, that like you can see the proliferations into the skin, some kind of small opening. So this is the one opening. This is a one type of hymen where there is a many openings are present. This is one type of structure where we are having two big openings present, and this is a structure where we have a one big opening is present. So that kind of different openings can be visible into the hymen, those tissues around the vagina. So this is completely intact, and this is with one opening, many proliferations, two proliferations, or one big proliferations. So we can say that what is normal out of this? If the female is having the periods, so if the structure is completely closed, or the structures openings are very few and small openings, assume that this is a complete closed structure. So female will start her periods, her menstruation, and if the hymen will be completely closed, then from where the blood will come, will go outside. So there is no room, the body, the vagina can leave the blood outside. So menstrual blood will start collecting inside the vagina, and that can be the source of pain, or severe pain, or endometriosis. Endometriosis, where this endometrial particles can start growing anywhere into the uterus. So we don't want the vagina filled up with the blood. We want the menstrual blood to go outside. And for this flow, we need an opening into the hymen. So if this is the opening, so through this opening, the blood will leave the body, isn't it? So that should be the right type of openings or the structures which should be present into the vestibule if the female is menstruating. And not only this, every month it is required. And if the opening will be small opening, so you can understand the vagina is going to shed out, leave the blood which is going to collect. So more collected blood will stay into the vagina, and small blood will keep coming outside, because the opening is very small. That it's not a flow female will feel. It's like drops of the blood, and that kind of shedding of the period cycle can be longer in a female, 3 days, 4 days, 5 days, 6 days. A small amount of blood is keep coming. So because they have a small opening inside, and there are many openings, so you can understand that more blood can leave the body. And if the openings are more bigger, so even that you also might have seen some kind of big particles, blood clots are coming in from the vagina. So those bloods can also leave the body. Okay, so this kind of blood flow is depends upon what kind of hymen is skin tissues are present down there. And more close means more painful, more collection of the blood inside. More smaller means more longer days of the period cycle. Period this when she's going to shed that 3 days, 4 days, 5 days, 6 days. So it should be enough openings, and through that opening, blood should leave the body. So according to that, we divide the hymen tissue into 5 different parts. So the one, when the opening is big, it is a normal hymen. So we have an opening, so the blood can leave the body. And even we have an opening, if you want to insert your finger inside and want to check that cervix, uterus, internal organs, so there is a room to go in, and there is a room so something can leave the body also. It's a good hymen, a normal tissue actually, which is not going to give pain to the female. Okay, so during penetration, because the openings are big. So this kind of hymen will, this kind of vagina, when the hymen is spread on the sides, will not give her pain during the penetration, or first time sex or first time penetration will not be painful. But if so this is normal, and the second is imperforate. Imperforate means when there's no even a single opening present down there. So that is very dangerous for our females. They're going to have problem with the collection of the blood, more prone to have endometriosis, pelvic pain issues, and a lot of period pain issues also. So that is not a good type of vagina, and the tissues into the vestibular region. So we don't want imperforate hymen, and in those cases, doctor has to create like openings. So they will do some kind of incisions, and they will create openings into the hymen so the tissues blood can leave the body. Okay, so this is not at all a good region, good type of vagina. It can be this micro perforate. So perforation is there, periods are going on, but this kind of female, the penetration will be very difficult for her. She can't insert the tampon, menstrual cup, finger inside the vagina because opening is very small. And if this female will go for sexual intercourse and the penetration of the penis, so that will be very, very hard for her. She can't penetrate inside the vagina, even her own finger, because the tissue opening is very small opening. And sexual penetration is going to give her a lot of pain, difficulty, stretching pain, tight tissues. She will feel that something is there, something is closed, and she can't go inside. And if they will try to do a lot of force for the penetration, that is going to give a lot of pain to the patient. So this is micro perforate hymen. Again, it's not a good part, a good structure present down there. Yeah, it is good. Before that, till the time female is external vulva, vagina, before puberty, this kind of structure is present, that is fine. That kind of structure is present, it's okay. But after puberty, we need openings, because after puberty, uterus will be functional, vagina will be functional, cervix will be functional, uterus will send the secretion outside, even the cervix will like release a lot of secretions. That secretion has to come outside from the vagina, and then vagina itself is going to secrete a lot of this kind of liquid, and that liquid also has to come outside. So we don't want this collection of the fluid inside the vagina. So we need an opening, we need a doors, and through the doors the fluids should leave the body. So but we don't want completely closed structure. We want a smaller not very small openings also. We need a good type of openings down there. So that is very important. And one is a cribriform. Cribriform means D, this one. So in this image, you can say that there is an opening. Many openings are present, small openings. And through these openings, the vaginal fluid will leave the body, blood will come outside, but penetration inside the vagina will again be difficult, because the opening is not one firm big opening. It's like skin tissues are present. So whenever she will try to penetrate inside the vagina, that is going to give her pain and barrier. So there will be some kind of barrier that she can't penetrate in the finger or tampon or menstrual cup or anything inside the vagina, because the skin is intact skin in between. So some kind of septate, some kind of skin tissues are blocking it. And those females like C and D, they will experience pain during the penetration, or the pain during their first night, when they are having the severe pain during penetration. So yes, we can understand the skin tissues are present, and if they will do the forceful penetration, they might, during the forceful penetration, the skin is going to go for tearing, lacration, and into the skin, we have a very minute, small blood capillaries are present. This is skin tissue, a mucosal skin layer, and which is present with the mucosa. So they have a blood capillaries, minute blood capillaries. So whenever we will tear that forcefully due to the forceful penetration, so that is going to give breaking of the skin and tearing of the skin, laceration of the skin, and the arteries will be broken. And when the arteries will be, the skin will tear, we can even experience some kind of blood also, because of the tearing of these tissues. So blood strain can be present also in that case. But these kind of structures are present in a very, very young girls, like around 14, 15, 16, 17, 18, because, what is creating these proliferations? Uh, what this one, like estrogen hormone is responsible when our body is going for puberty. Estrogen will come into picture. Our internal ovaries are getting functional at the age of 12, 13, 14, and when we are going to hit our first menarche. So before hitting the first menarche, it is body responsibility to create some kind of openings. So prepare the structure so the blood can leave the body. So this is the preparation of the body. The hormones will come, specifically estrogen hormone, and those hormones are going to create a thinning effect over the skin. They will create proliferations. So we can assume that more estrogen effect, like 1 year, she started the period with the 1 year, with 2 years, we can understand more estrogen will be there. And whenever the estrogen will be there, that is going to create a more thinning. So if the female is having periods since 5 years, so her skin tissues will be more wider, more open, more thinner tissues. If she's having periods from last 10 years, so more estrogen effect is going to create more bigger thinning and more bigger openings inside. So the female who is around 20 years, so we can understand that those female will not present this small kind of opening. Those female might have this kind of many opening inside because of the estrogen effect, many thinning of this tissue. And more bigger, she'll go like 25 years, 30 years. So there might be more bigger openings. Yeah, we can understand if she never penetrated anything inside the vagina, so there might be some flap of the skin present in the middle or sides, but the opening can be more bigger as per the effect of the estrogen. More estrogen effect from many years, more bigger openings these tissues are going to create. So this is a Kribri form, and there might be septate hymen, one kind of septum tissues also present, a vertical or transverse, some kind of skin tissues present between the hole. So it's not a complete hole, one big opening. And those kind of hymen is also going to give pain to the female when she try to penetrate inside, and when she penetrate forcefully, so this skin tissue, the septum which is present, that is going to go for breaking, and that is going to give show you the blood on that day. So this is the hymen. Now, when we're talking about hymen in fetus, when we were baby, our mother was pregnant with us. In fetus, our vagina starts as a solid tube. So now our vagina was not like a hollow. It was not like hollow completely. There was a solid tube. Whole vagina was filled up with the mucosa. So completely there was mucosa filled into this whole vagina. And the vagina was not also developed. Okay, so as we born and we came outside into the world, this mucosa, it's like a frozen ice, is present inside the vagina. Now this mucosa is gonna dissolve. So once the female will she will born and she will keep getting more bigger, younger, she'll move towards the puberty. So this mucosa is gonna dissolve. So the ice, assume the ice was filled into this vagina, and the ice is gonna melt. And the melting of the ice is gonna always start from the cervical side, cervix side. So the cervix, upper part of the vagina. So this mucosa will dissolve, then the downward mucosa will dissolve. So the tissues will start dissolving from the upper side. So they will dissolve from the up here first, then they will dissolve from here, then they will dissolve from here. And till the time we will be around the puberty time period, the whole vagina mucosa will be dissolved and very thin out. So very soft mucosa will be there. So our vagina will become open vagina and ready for the periods. And even our structure is also developing during the puberty time. The female is also growing, our organs are growing, their length, their size is increasing, their length is increasing, their width is increasing. So that is gonna create the dissolving of the tissues. So you can assume the female, when she was born, her vagina was very small and the whole vagina was having this kind of mucus. The more she will grown up, the more length of the vagina will increase. So now you can understand the tissue will left at the downward part, and vagina will keep growing upside because uterus is developing upside, the cervix is developing upside, reproductive organ is developing hole into the length. So this remnants, these tissues will left at the bottom, and these tissues will be very thin layer of the tissues. Okay. So this is how in fetus, vagina starts as a solid tube. In that solid tube, the cells start disappearing as the girl grows from top near to cervix to the bottom. So from up to down, the tissues are going to kind of dissolve. And the remnants which left at the end of the bottom, we are calling it as a hymen remnant, or a hymen means is a covering. It's a covering, one covering. So this hymen will left there, and then different female can have a different shapes of these tissues, different kind of thinning or thickness. Some females can have a thick hymen tissue. Some female can have a very thin layer present. Some female can have a one small opening. Some can have a many openings. Some can have one this kind of big openings, two or three big openings. Some can have just a very one big opening, or someone can have a just completely closed. But we don't want closed. If it is a closed or this very small, like this kind of micro perforate, so they are going to give difficulty in passing the blood also from the vagina. So this is the hymen. What is the function of the hymen? We understand so far that in young age girls, the mucosa of the vagina itself, okay, in the young girl when she's 1 year old, 2 year old, 3, 4, 5, 6, 7. So the mucosal sheath, which is present inside the vagina, that is very, very sensitive. Okay, so we don't want any pathogens, bacteria to go inside and damage that sensitive areas. So the mucosa of the vagina is very sensitive to irritants. Even small amount of dirt can cause inflammatory reactions inside. And before the puberty, we understand that we can note down that pubic hair was not present before, isn't before the puberty. During the puberty, pubic hair start getting developed. Vulva start getting developed. The fat cells, the subcutaneous cells, the glands which is present in the mons pubis, labia majora, minora, the structure of mons pubis, labia majora, minora, the skin, the glands, everything is developing during the pregnancy, this puberty. So before puberty, that mons pubis, pubic hair, fat pad, labia majora, minora, or all these external structures, vulva, were not fully developed. So the chances of infection, which can go and do the infections around the vagina is more. So we don't want our vaginal canal to get infected. So this kind of small protective layer of the skin is present at the entry of the vagina, and it prevents the dust, the entry of the dust, infections, or all the impurities. So hymen is serving as a barrier for protection or for our vagina against the dirt and debris. So our vagina and reproductive system can become safe and secure. They should be secure. So this is the responsibility of the hymen. Sometimes some females, they can have a congenital anomalies. It means that their hymen tissue is very thick tissue, or there's no opening at all into this particular area of the vaginal openings. So vagina is completely closed. We call it as a imperforate hymen, as I already showed you, this one. So this is an imperforate hymen, completely closed. So this is a congenital deformity. She has those kind of tissues present there. So, and sometimes female is having a big septum tissue, which is not getting dissolved with the effect of estrogen. So tissues layer is present. It can be this kind of it can be the transverse or longitudinal layer which is present, and then it is separating this openings into two parts. So those kind of vaginas, the penetration will be very, very difficult, and because the tissues are very thick tissue, and we call it as a congenital anomalies, where hymen without the opening completely obstruct the vagina. It is because of the failure of hymen during the fetal development. So that mucosa, which I told you that the mucosa has to develop, the cell has to disappear, but those cells were not disappeared and the remnants are left there, the skin tissues are left there. So we call it as the imperforate hymens. So doctor, in those cases, the gynecologist has to create a room. They will do the opening. They will do the cut into the openings. They will cut the skin and create openings. So that is the solution for them. Same way, some females can have a hard band, one same kind of skin flap, which is very, very thick and that is not getting dissolved under the effect of the estrogens and hormones. So the septum tissue can present and sometimes larger portion of thick tissue left horizontally or vertically and create a septum. And that females will also have a difficulty during the penetration and they will feel obstruction. So the sexual intercourse and penetration will be difficult for them. So they can be the source of vaginismus, that female cannot have penetration because of this congenital anomalies because hymen tissue is present there. So this is the fact about the hymen. And I have these pictures, like different types of vestibule is present. I want to show you the hymen part here. So this is the vestibule of a very young girl who is around 13 to 14 years old. Okay. So this is the labia minora on the sides. This is the clitoral hood. And this is our hymen remnants into the vestibule. So you can see very small opening is present. And through this opening, periods will keep going out, blood will keep going outside. But the penetration of the finger or tampons will be hard for her. If she'll try to penetrate, it's going to give her a lot of pain. Okay, so this kind of vagina will be painful vagina for the painful sex or painful penetration will be there if she has a small structure. So very, very, you can understand, you can see it's good moisture is present, very healthy structure, shiny and young structures, skin tissues are not damaged at all, the vagina is safe, if vestibule is healthy, the structures are healthy tissues, okay? And the second one, you can see in this picture, this image, so we have the clitoral glands, so this is the glands of the clitoris, very small labia minora on the side, this is labia majora on the side going on. And you can see over here, this particular spot is a urethral part. Now here, this is a urethra, okay, which is not visible. Over here also, it's not visible, urethra is not visible. And beneath the urethra, there's a big opening. The hymen is, the skin tissues are going on the sides. So means hymen is broken hymen and hymen tissues is it's like a curtain. There was a completely closed curtain. So this is a closed curtain with the one small orifice, but this curtain is spread into sides. So the curtain is having a big opening. So you can see that. So the hymen tissues are splitted on the sides. And we have openings, and through this opening, we can penetrate, we can insert, if we want to insert something inside the vagina. Okay, like a tablet, some medications, some test, gynecological test or pelvic floor test. All this, like in this type of vagina, we cannot go for gynecological test. We cannot go for pelvic floor assessment, transvaginal assessment, because hymen tissue is present. Okay, but in this case, we can definitely penetrate our finger inside and do the assessment of the pelvic floor. We can do the checkup of this cervix and the uterus and ovaries, internal structures from the vagina. So penetration is there. Sexual penetration is also possible in this female. Okay, so sex toys and sex objects can go inside because openings are present. Remnants are spread on the sides. Openings is present. This is again a structure, and in this vestibule, you can say this is a labia minora on the sides, and this is small urethra on the top. So this is a urethra, which is very visible. It is visible. Okay, urethra is visible in this case, and now here you can't see any ring-like structure. So vagina is having this kind of rings. If you see the vagina, can you see this kind of circular bumps, rings present? These rings, we are calling, these rings-like structures are present inside the vagina, and they are mucosal tissues, the hymen tissues, not the hymen tissue, that the rugae, we call it as a rugae, round circular lumps. And that lumps are present inside the vagina, not outside. So now those vaginal tissue should not be visible into the vestibule. But some females, these vaginal tissues are visible into the vestibule. So as soon as female, you will see the vestibule area of a female. Can you see this ring-like structure is visible here? So means vagina is visible and vaginal tissues are visible. So means there is no hymen remnants. And it's completely, the hymen tissues are dissolved and they might be just completely spread out on the sides. And they are causing that much, even the vagina is having that much of effect in the as aging effect and childbirth. So baby came out from the vagina and they completely, the tissues are, hymen tissues are completely dissolved. And we can even see big vaginal openings, vaginal orifice, and through the vaginal orifice, vaginal structures are also visible into the vestibular area. So after, this is a case of vaginal laxity actually, because when and the pelvic floor weakness. So when the pelvic floor muscles are not strong enough, they will not close from the down. And if they don't have the strength, the gravity will keep pulling the vagina downwards. And that is going to create the fall of the vagina or vaginal prolapse. Okay, so this is a vaginal prolapse, damaged vagina, and that is very, very more like very common to see after many childbirths through the vagina, vaginal deliveries. Okay, so it's very, very common to see in females. Clear about hymen or any doubt? Girls, are you clear?
Yes, ma'am, very clear.
Great. So hymen is a sign of virginity. This is one big myth, actually, I will say. And what do you think? That hymen is a sign of virginity? If hymen will be present and completely closed hymen, so how we will have periods? So, but the whole world is thinking that hymen should be present when we are having first time intercourse. So how many of you have heard this thing that hymen is a sign of virginity? Have you heard that?
Yes.
Okay.
Yes, ma.
Yes, ma'am. Yes, yes.
So
In every tradition, myself.
in every culture, in every
Every
country, we have this particular one belief system that hymen should be present and female should bleed on her first night. But as we understood that hymen thinning is under the effect of estrogen. So the more estrogen, the more periods, the more years of the period female is going through, the more bigger opening will be there into the area, downward area. So might be some, even our functional activities, they might create more thinning of this hymen tissue, and then the hymen tissues can dissolve and they can separate. The openings can become big when the female is getting aging, through this aging process, through this gravity effect, through this Valsalva effect, and the functional activities which we are doing. Hymen was a sign of virginity that was given, this kind of statement was given from our ancestors, like our grandmother, grandfather. They used to have those kind of, they used to believe into this particular thing that hymen tissue should be present. But one important thing which we are missing here nowadays, that if you understood our mother, our grandmothers, so when they were getting married, the age was around 12, 11, 13. So they were getting married at the very early age. And they used to have this kind of activity, the sexual activities also at the early age. So at early age, this kind of vaginal tissues present, if that the presence of this kind of structures is very, very common. But the early age. But nowadays, we are getting married at the very late time. So sometimes we are getting married at the 25, 30, 35. So according to this aging, so we are having the periods from last 10 years, 15 years, 20 years, 25 years, and still we are not married. But because of the estrogen, our tissues might be more open tissues down there. Okay. So the belief system was given from this grandparents, because our grandmothers, they used to have sex at a very early age, at the age of 13, 14, and 15. And we nowadays, we are having our intercourse and our sexual activities and our marriage at the later time period. So there's possibility that at later age, later time, due to this estrogen effect, we might have a bigger opening and we might don't bleed. We already have those kind of big openings in our hymen. And if this kind of openings are present, we might don't bleed, we might don't even have a pain. Okay. So hymen is not no more a sign of virginity. We should not count it as a sign of virginity as per today's era, because in today's era, we are getting married at the late time. And up to that time, there's many times hormones effect is gonna create more thinning of our tissues. Okay, so we should not believe this anymore. This is what the science says, actually. And our reproductive system can't be functioned if the hymen tissues been present. We can't have penetration, we can't have sex, we can't have this sperm collection. So this is important that we should have already soft tissue down there, and females should not feel pain. So after the hymen, let's understand vagina. So vagina, we used to believe that vagina is an organ, is a sexual organ, but it is again a myth. Vagina is not a sexual organ. Vagina is a part of reproductive tract, reproductive or system of a female body. So vagina is a closed muscular canal which runs from vulva outside. Outside we saw the vulva was there, vestibule was there. So from the vestibule, if you just see that we'll just insert your finger, keep inserting your finger inside. So the whole vagina is present inside the body. The question, if I'll ask you, can you see vagina? Can we see vagina?
No.
No. We can't see vagina. Okay, vagina is inside the body. What we can see outside is just the opening of the vagina, external opening of the vagina. So vagina is a long canal. It's like a tube, it's like a passage, like a urethra is a passage. Same way vagina is a passage. Urethra is a passage from the bladder, vagina is a passage from the uterus. Vagina is a closed muscular canal, runs from vulva outside to the bottom of the cervix inside. So inside we have this uterus, and uterus is having a one cervix. So this is the cervix of the uterus, and we have this external os into the cervix. So now this uterus is somewhere protruding into the vagina. So vagina is starting just down there. So this, I'm forming a vaginal canal. So this is the vaginal canal. And into this vaginal canal, if you insert your finger, you can see the protrusion of the cervix, which is a part of the uterus. So it's a canal, it's a kind of long tube. And into this whole long tube, there are 4 walls of the vagina: anterior wall, posterior wall, and 2 lateral walls, so side walls. And so let me show you. So can you see this? So this is something which is visible outside into the vestibule. Once we'll open it, so this part is outside visible, and on that part only the hymen tissue is present. Okay, it's outside here. Now this is a vagina, whole long tube. If I'll open it, the vagina is something like this. So the tube. So what is present? How many walls are present? Anterior towards the bladder, posterior towards the rectum, and lateral, right lateral and left lateral. So these are the four walls of the vagina, and into this anterior wall, the vagina is collapsed, like it is closed, it's not open. So anterior wall is normally touching always the posterior walls. It's like this kind of closed structure, okay, like this, completely closed. And the pelvic floor is coming from the sides. So assume my hand are pelvic floor. Okay, so pelvic floor will do compression at the bottom part of the vagina. Pelvic floor is present at the lower part, lower 20% of the vagina. So they will keep creating a contractions, closing, and because of this closing, vagina will be closed. So normally, right now, when we are sitting and we are doing this, attending this learning webinar, so our vagina is collapsed vagina. It's like closed vagina. Anterior wall is going to touch with the posterior wall, collapse. And whenever we want to insert something inside the vagina, so it can open up like a condom. So where the condom can extend, same the vagina can also extend. So this is the four walls of the vagina. Anterior will be always towards the pubic symphysis, towards the upper side. And with the anterior wall, we will have our organ, anterior organ. So which organ is present anterior to the vagina? Can you tell me? Which organ is present anterior to vagina?
Uterus.
Bladder.
Bladder, yes.
Bladder.
Okay, so let me make bladder. Let me find the bladder. Where is my bladder? Okay. So this is a bladder. This is the bladder. And we have a pubic symphysis. And just behind the pubic symphysis, bladder. And then this is a vagina. So you can see here the anterior wall of the vagina, anterior wall is gonna connect with the, is gonna come in a connection with the bladder and urethra. Okay. And posterior wall of the bladder is gonna come in a relation with the rectum, anterior wall of the rectum. So anterior wall of the vagina is going to come in a relationship with the posterior wall of the bladder. And posterior wall of the bladder
With
is,
the vagina.
sorry?
The posterior wall of the vagina connect with the anterior part of the rectum.
Yes, clear, isn't it? It's completely clear. And on the sides, you can see, right, this is the left side and this is the right side, right and left sides. So what is present on the, if you stretch right and left side of the vagina, so you will ended up into the pelvic floor muscle. So pelvic floor muscles are present on the sides. So whenever we are doing transvaginal examination of the pelvic floor, we are stretching the lateral wall of the vagina, like on the sides, left side and right side. So assume that I'm stretching it, this vagina, and after stretching the lateral wall of the vagina, I'll go on the pelvic floor muscles. So these are the pelvic floor muscles on the side. Okay, on one side and other side. So laterally, if you stand, this is a room. So anterior to the room, bladder and urethra is present. Posterior to this vaginal room, rectum is present, and sides of these vaginal walls, the pelvic floor muscles are present. Okay, so if I'll just attach it like this, so you can understand that if you move on the sides, if you stretch the muscles on the sides, mucosa on the sides, you can land upon, you can check the pelvic floor muscles. It's like a condom. So you are stretching the vaginal tissue and your finger is going to touch the pelvic floor on right and left. So there are four walls of the vagina, and this vagina is having three layers. So one is the outer peritoneal layer. Every organ is having three layers mostly. So if you understood the uterus is having peritoneal layer, perimetrium, then myometrium, then endometrium. If you understand the bladder, so bladder is having a peritoneal layer, then it is having a detrusor muscle, and then it is having the inner mucosal muscle. Same way, vagina, so middle layer is a smooth muscle, made up with the smooth muscle. Outer layer is made up with the protective layers. So which protect one, separate one organ from the other organ. And more inner layer of this vagina is, or these organs are having, they are made up with the mucosal layer. So like mucosa of the cervix, mucosa of the bladder, mucosa of the vagina. So they are innermost layer of the organs. Mucosal layer, mucosal sheath. They have all this, pH level, and they have this ecosystem, they have this presence of the bacteria and healthy bacteria into this inner sheath. So assume that we have this room, and this room is a vaginal canal. So this room will have three walls. One is the outer wall, one will be the middle wall. Middle wall will be made up with the smooth muscles, and which is going to create a contractions and opening and closing, and one will be more inner, this kind of curtain sheet. So with the mucosal layer, we call it as a mucosal layer. So there are three particular layers are present into the vagina. And innermost, like from out to in, these layers, we have these arteries are coming, which is supplying the whole vagina. The venous system is completely present there. Then nerves are also present. Nerves are not that much into the vagina, because if you touch your vagina is not that much sensitive. So nerves are very few number of nerves are present inside. But arteries are high, too much of vascularity is present inside the vagina, and lot of venous area is there. And so let's understand. And another thing is this inner layer of the vagina, they have this kind of ruggage, this kind of, can you see these folds? So this kind of ruggage are present. So what if you want to stretch out the tissues, you can stretch it out. So that ruggage are responsible for creating the elasticity, stretching effect, elasticity. So more bigger, baby can come outside, isn't it? The head of the baby is kind of this much of. So that 10 centimeter of the head of the baby, or 5 centimeter of the head of the baby can come outside from the vagina. You can insert something inside the vagina, inside. You can insert one finger, you can insert two fingers, you can insert three fingers, you can even insert the whole hand inside the vagina, or the baby can also come outside. So that much of elasticity is because of this innermost layer, mucosal layer. And into this mucosal layer, we have the presence of ring-like structure, ruggage, which will expand, which will stretch out, which will go for flattening, and then give the diameter, bigger diameter to the vaginas. So vagina is having 3 layers and 4 walls. Another thing is, vagina is lined with special skin called mucosal cells. As I told you, mucosal tissues are present, and these mucosas are arranged in folds and ridges, which we are calling it as a rugae. So that ridges, which I told you, the ring-like structures are the rugae, R-U-G-A-E. So we are calling it as a rugae. Circular bump-like feeling inside. If you insert your finger inside the vagina, you will feel something, some rings kind of structure, some kind of bumps are present. And this, the mucosa is covered by smooth muscle, and the function of the smooth muscle is to help. Now, whole mucosa, the completely whole rugae, the completely mucosal sheath is covered by a layer of the smooth muscles. And the smooth muscles means, what does the smooth muscle do? Smooth muscles do the contractions, some kind of cramping, not a cramping, some kind of contractions. And because of the contractions, the liquid, whatever liquid is present on upper part of the vagina, the liquid will keep moving, the discharge, that discharge will keep going downwards, because they will do the contractions, squeezing effect on the top. And because of the squeezing effect, the liquid will keep moving downwards. So whatever liquid is coming from the uterus, it is coming from the cervix, the liquid will keep moving downwards towards the orifice, and they will leave the body. So that kind of structure is present inside the vagina. And it helps to move all the discharge and blood towards the vaginal opening. The rugae and the smooth muscles allow the vagina collapsed at the rest to keep the vagina closed and to keep the air out. We really need the rugae, the folds inside the vagina. So if the fold will be there, so anterior wall of the vagina will touch with the posterior wall of the vagina. It means the completely closing effect. So something like this, my hand, my fingers. So if we have this kind of ridges here, and if you, this is one finger anterior wall, and if you touch with the posterior wall, so you can see that these rugae will fit in each other. So they're going to create a closing effect, and because of this closing effect, nothing can go inside the vagina, not even the air. So we don't want any air entry inside, because if air can go, air will go, air is going to create a dryness. Our vagina is wet, And wetness, we need a wetness, we need a moisture inside because the walls are touching each other and we don't want dry walls touching each other. We need a moisture inside. And this moisture is, this kind of whole work is done by some healthy bacteria inside the vagina. We have a vaginal ecosystem. And into this ecosystem, we have a lactobacilli bacteria present in upper two-thirds part of the vagina. And lactobacilli is gonna do lot of this lactic acid secretion, and lot of even mucus secretion is also going on. So too much of lubrications keep going on into upper two-thirds, and that lubrication is gonna maintain the moisture inside the vagina. So that lubrication, that moisture, that hard work of the ecosystem of the vagina should not get dry. So that is the responsibility of this ruggase. And they will do the closing effect inside the vagina. We don't want flattening of the rugged. Assume that the vagina is not having these circular bumps. It is having a flat kind of feeling. Tissue, skin is flat. If the skin will be flat. So you can understand. Now see my face. So if this is a flat skin, so entry of the air will be very easy because we don't have any circular lumps to block it. Okay, because we have a flat. So assume that this is a flat. So through this flat, the air will be entered. But if we have this kind of, this kind of ruggage, so air can't enter inside and cannot dry this internal part of the vagina and cannot dry the cervix, inside external cervix. So we need this kind of moisture inside the vagina. So let me again show you. These rugged and smooth muscles allow the vagina collapsed at rest and to keep the vagina closed and air out. And allow the same ruggeds are responsible for the stretching. Whenever we want to insert our finger, our hand inside the vagina, something inside the vagina, so we need an opening. So that ruggeds are responsible for the stretching. It's like a rubber band. You can stretch it out and you can again, the rubber band can collapse again. The vagina smooth muscle is surrounded by the network of blood vessels and sensory nerves. So now if I was just telling you that there's not too much of nerves are present, it's a few number of nerves are present, but those numbers of nerves are present at the lower downward part of the vagina. So if I divide, if the vagina as the whole length of the vagina is like, for example, it's 100%. So this is a 200% length is there. So in upper, if you again further divide the vagina into upper 50% and lower 50%. Okay, so this is lower 50%. So in upper 50%, again you divide that into upper 25%. You divide that vagina into 4 parts, 25, 25, 25, and 25. So divide that into 4 parts. So let me do it again. So divide the vagina into 4 parts, the whole length of the vagina. Okay, so this is 1, 2, 3, and 4. So more upper, you can see towards the cervix, the arteries, more arteries are present, more veins are present. Okay, no nerves in upper part here. It's arteries and veins. You can see here, it's a vaginal arteries and vaginal veins, but no nerves. Nerves are present into the downward part here. Mild number of nerves are present. Into the second and third part, nerves are present. This yellow part is a nerve, okay? And the red and blue is the veins and the arteries, which is present on 1, 2, 3, and 4, everywhere. The whole vagina, we have arteries and veins. But the nerves are only present into this middle part, second and like this middle 25% part. The downward 4th part, very near to the vestibule, we have the presence of pelvic floor muscles. So these are the pelvic floor muscles. Pubovaginis muscle, superficial layer of the pelvic floor muscles. So they are present at the downward part, 4th part over here. So this is gonna create a contraction where the pelvic floor muscle has to contract. When they will contract, they will squeeze the door from outside. They will close the door and vagina will be closed. It means nothing can go inside the vagina. It's a safer vagina. So we need a good, strong, healthy pelvic floor muscles, good tone into the pelvic floor muscles, functional pelvic floor muscles, active pelvic floor muscles. And if the pelvic floor muscles will be loose, weak, lax, so they cannot create a closing effect. They will be open. And when they will be open, so it means the gravity is going to pull. It's always keep pulling the structures downward. So as per the fact of the gravity, the organs can keep falling downwards. And another thing, if the door is not closed, so gravity is going to pull also, and as well as air entry will be very, very easy. Our pelvic floor muscle has this always 70% of slow twitch muscle fibers. So those, we have an endurance, we have a special high tone into the pelvic floor as compared to other muscle of our body. And because of this high tone, the muscle is always creating a contractions mode. So they are always collapsing the around the vagina, around the orifice. So nothing should go inside the vagina. So closing effect is present. So pelvic floor is present around the downward part. And in upper part, you can understand that this is a vaginal area. And the vaginal smooth muscle is surrounded by network. Yeah, we understood this. Why vagina is sensitive? Like I told you that vagina is not a sexual organ, but still we are having sexual intercourse and we can always feel that sexual sensation inside the vagina. The vagina is not specially sensitive as a whole. We understood that. Yeah, upper 25% is not at all sensitive. Its lower third, the area close to the entrance, has concentration of the nerves ending that can provide pleasurable sensation during sexual activities when stimulating. This is also called the anterior wall of the, yeah, we understand this. Why the vagina is sensitive? There are three reasons behind that. The first is that whenever we are inserting something inside the vagina, the pelvic floor muscles will grab that particular thing. So if you are inserting the finger, if you are inserting the penis, or if the penis, when we're talking about the penis or sexual object, they have a bigger diameter. So because of the big diameter, that is gonna touch the skin of the vagina. And because of this touch, we have a nerves. So the nerves is gonna send a signal to the brain. So nerves are also present as the small nerves, which will send the signal. And the second is the pelvic floor will also grasp whatever you are inserting. There will be grasping effect, and grasping is going to give proprioception to the female. So that is a kind of biofeedback for the brain that something is coming inside, and this pelvic floor muscles will pull that particular thing. So grasping, proprioception. The sensation will come from pelvic floor or from this kind of some kind of nerves which is present at the lower part. The third thing which is available here is sexual hormonal receptors. So in our female vaginal downward part, this part of the vagina, lower 25%, this part. In lower 1/3, you can say lower 1/3 of the vagina, we have a special sexual hormonal receptors are present. Like we have a secondary sexual organs like the areola, we have a breast tissue, we have nipples of the breast. So if you touch the nipple of a breast of a female, or if you touch the breast of a female nipples or areola, if you see her pubic symphysis, so that is going to send that particular area is going to send you sexual sensations. Why? Because every area, secondary organs, they have a sexual receptors. So whenever those special hormone will be released into the bloodstream, testosterone, estrogen, they are going to activate the skin of that area, mucosa of this area. They're going to create more sensitivity to that particular region. So because of the hormonal receptors, the area is sensitive. Because of the pelvic floor muscle, the area is having grasping effect. And because of the nerves, the area is having a sensation. So that's why we are having this kind of pleasurable sensation during the sexual activities. Not only these three things, another very important structure which is present here is, now assume which wall of the vagina, and which is, okay, if I'll show you. Let me just take you to the slide. Now come back. come back and try to understand this image. All right. So we were talking about vagina. So if you insert your finger inside the vagina, insert. So, and which part of the vagina is gonna come in relationship with the clitoris? So this is the clitoris, this is the vestibule, and this is the legs of the clitoris. So which layer of the vagina is gonna touch the clitoris? Side part of the clitoris. Anterior, side, or posterior? This is
More
the
of anterior.
anterior wall. Okay, so this is the anterior wall of the vagina. So if you insert your finger inside and if you touch the tissue, if you stretch the vagina anteriorly, so this assume that we are having the clock here. So into this clock, 12 will be urethra, 6 will be downward rectum, but on the sides, 11 o'clock, 11 and 10. On other side, you can understand 1 or 2. So 1 and 2 on left and 10 and 10 and 11 on the right. So this particular region, if you insert your finger and palpate, do the stimulation. So from inside the vagina, you are touching the posterior part of the clitoris. Did you understand that?
Yes, yes.
Okay. So if you are touching the clitoris from outside, this is the glans. And now if what happens through the vagina? If you insert your finger inside, so assume your finger is inside. So this is the clitoris. So into this one, anterior wall of vagina, and one side 1 and 2, and other side 10 and 11. So this particular part is you are touching the posterior aspect of the clitoris, legs of the clitoris or glands of the vestibule through the vagina. So whenever some big object which is having a diameter, bigger diameter, so like erected penis, if the erected penis will go inside, that erected penis is going to touch this particular site. So means they're going to touch the clitoris, and clitoris is going to give us a sexual sensation, that is our sexual organ. So that particular side which we can touch the clitoral network through the vagina. So means I am the clitoris and you can touch me from anteriorly, from outside, and someone is touching me from the back. So the penis is touching me from the back side, but the sensation is coming from throughout the clitoris. So female will feel lot of sexual sensation because her sexual organ is being touched. And these particular two sides, 10 and 11 and 1 and 2 is discovered by Dr. Grafenberg. He was one gynecologist who discovered that, oh, this is the sensual part inside the vagina. And he gave that part his name. We know that as the Grafenberg spot or G spot on a short form. So we have a G spot present inside the vagina. So G spot is that particular site through which we can touch the posterior aspect of the clitoral network. So did you understood the G spot and where the G spot is present? G spot is present on the anterior wall of the vagina, both sides of the urethra, 10 and 11 and 1 on 2. So there are two G spot, not one G spot. There are two G spot, right and left G spot. So what is G spot? G spot is an area inside the vagina present at the anterior wall of the vagina where we are touching the clitoral posterior part of the clitoral network. Now, are you clear about G spot?
Yes.
Okay.
Yes, yes.
So next time you can palpate your G spot. Okay. So assume go towards the anterior side. So these four structures, what pelvic floor, which is grasping the penis. So pelvic floor will grasp. They will hold the penis. They will try to close the vagina. Second, the hormonal receptors, which is present in the downward part. third, that some nerve endings which is present at the downward part. And the fourth, very, very important part is you are touching the clitoris from the inside the vagina. That's why we hit orgasm during the vaginal penetration. We are touching the clitoris or our sexual organ indirectly, not directly. We are touching it indirectly through the vagina. And this is going to give us a hit of the orgasm. And we like sex through the vagina. But touching the organ directly or touching the organ indirectly, there is a difference in both. So nowadays, if you have seen that most of the time when we are into the relationships, lesbians, when the girl and girl are into relationship, so girl is touching the clitoris of a female directly from outside. So when the direct touch is there, the more sexual pleasure is there, more orgasm is there, more satisfaction is there. So normally 90% couples, they are satisfied sexually when girl to girl are there, because they are stimulating the clitoris directly from the outside. But when we are talking about the girl to male, so male, they don't have understanding about a female sexual organ. They do not even about the sexual organs. Their brain is always into the vaginal penetration. And vagina, sometimes after having a baby, the rugaes can get flattened. So these rugaes can get flat. And when they will have a flat rugae, so proprioception will be less. And if there will be flat rugae on the anterior wall, so we can understand that flattening is there. So the tone of the anterior wall of the vagina we lose, because during our pregnancy time, the uterus is going to get expand. And when this uterus is getting expansion, so that is going to expand the anterior, because you understood that it's a balloon and balloon is expanding. So they're going to do the stretching of the anterior wall. You can see the anteriorly uterus is expanding. So this particular part is going to expand. So when that will expand, it is going to stretch out the anterior wall. So anterior wall of the vagina is going to go for stretching for 9 months. And because of this continuous stretching for 9 months, they are going to lose the tone into this particular region of the vagina. And the rugaes are going to go for flattening. So the more time the female is going to get pregnant, the more flattening of the vagina, the chances of getting flattening of the vaginal rugaes on anterior wall will be there. And the second is not only the pregnancy, even the childbirth. When baby is coming outside through the vagina, so it's more stretching, labor stage 2, when baby is coming outside, sometimes baby can stuck there, and more prolonged labor stage 2 is going to create overstretching of the vagina. Not only from the anterior wall is already stretched out, already flattened, but other sides will also go for flattening. So in this case, our vagina can lose the tone. And after that, estrogen hormone, the sexual hormones, if they are estrogen hormone, the lack of estrogen hormone is there, because female is going to feed the baby for 1 year, 2 years. So till the time the prolactin hormone will be there, there's less chances of getting good estrogen. So that can also create a kind of affect the tone of the vagina. And multiple pregnancies can create multiple time flattening of the vagina. So that can, so some females, they don't have a good sexual feeling after having babies, or we call it as a low sexual sensation inside the vagina. They feel that they cannot grasp the vagina, not only the vagina itself, even the pelvic floor muscles, because during the pregnancy, a lot of stress is going to fall. The weight of the baby is going to fall throughout the pregnancy over the pelvic floor. Relaxing hormone is going to create a lot of relaxation into the pelvic floor. And Valsalva is also going to increase. That will put a stress over the pelvic floor, and as well as the relaxing hormone and the childbirth. So during the childbirth, baby will come outside, and sometimes episiotomy, perineal tears, so damage to the pelvic floor muscles, and more damage to pelvic floor, more weakening of the pelvic floor is gonna lose that grasping effect. So means two things will not be feasible, not be is in the favor of a female for the sexual activities. One will be the flattening of the rugaes after childbirth, and the second is the weak pelvic floor. So that can give low sexual sensation to the female, and we as a female, we don't feel good during sexual activities. We don't feel sex, and we think that I can't feel, something is inside my vagina. So too much of laxity can be there. Okay, so because of the flattening and the weak pelvic floor or the hormones. After menopause, hormones can also come into the picture. So, male to female, sometimes we don't feel sex. And that's why, as per the statistics, as per WHO, only 30% of female who are into male to female relationships, they are enjoying the sex, or they might feel the orgasm. Rest of 60 to 70% of females, they don't even feel that sensation inside the vagina after some times in their life. And like vaginal laxity is affecting 80% of females, 80% of mothers. And if vaginal laxity is there, you can directly correlate that the female sexual dysfunctions will be there. The low sexual sensation, the chances of having the low sexual sensation will be also high. So many of our female, they don't feel something inside the vagina after some time. And if they don't feel inside the vagina, so they will not get stimulation to the G spot. And if they will not get stimulation to the G spot, sexual feeling, low sexual sensation will be also there. And no touch, direct touch, because the partner and female itself, she's not aware about her own structure. So that is very, very important part. So vagina is a sexual organ. That statement is given by male actually. Male is going inside the vagina and they are having sex inside the vagina. Vagina is giving them the grasping effect and the grasping of the penis, what they enjoy actually. When you hold their penis, they will like it. So they will enjoy it. But, and this grasping effect is coming from the vagina. But the grasping can come from the anus also. So anus is also a sexual organ for them. Vagina is also a sexual organ for them. Whatever can give, even our manually, when you hold their penis, they will also like it, your partners. So nowadays is oral sex, anal sex, vaginal sex, they enjoy them. But we as a female, we don't enjoy oral sex, we don't enjoy our anal sex, because we don't have that any direct stimulation to our organ. Our organ is different organ, which is present at a different area, which is present outside actually. So that is the lack of understanding about our own body we all are having. And I think it is important that we as a healthcare provider should be able to help our patient if they are asking those kind of related questions to us, and if they are suffering from some kind of low sexual sensation. So we should be understanding and we should give them the education, right education about their right sexual organ, primary sexual organ, and how to stimulate the sexual organ outside and by internal stimulation to this G spot. And for internal stimulation, we need a good pelvic floor, and for internal stimulation, because that is going to give the grasping effect. And we also need a very good tone inside the vagina. And how we can maintain the tone with the good collagen diet. So we have to take a lot of collagen in our diet, as well as the probiotics. These things are going to maintain the tone, and the hormones should be balanced. We need a estrogen in our body. So try to take those kind of food, or those kind of good rest, good sleep. So estrogen effect, the period should be balanced in our life. If periods are balanced, hormones will be balanced. If the hormones will be balanced, our body will keep getting whatever as per the need of the body. So that is very, very important part about our vaginal tissues and vaginal structures. The majority of the vaginal, this is also called the anterior wall of the vagina, or the outer 1/3 of the vagina. It contains the majority of the vaginal nerves ending at the downward part, making it more sensitive to touch than the inner 2/3 of the vagina. The vaginal epithelium is more sensitive, and its structure is more indicator of estrogen at the downward level. And estrogen receptors are present, vaginal epithelial cells are present, pelvic floor muscles are present, and the G spot is present. Those 4 things are making our vagina sensitive during the sexual arousal. But the whole vagina has lot of arterial and venous supply. So you can see this structure from, this is a vagina, this is the uterus actually. This is the uterus, posterior aspect of the uterus, and this is the posterior aspect of the vagina. So you can see that uterine arteries are coming and too much of blood supply is there. So the whole vaginal upper 2/3 is highly vascularized. So too much of blood capillaries are supplying upper 2/3 part of the vagina. Okay, so and that should be healthy also. And we understood what is G-spot. G-spot is the clitoral network which we are I'm so sorry, girls. Okay. We also understand about the G-spot now. I already told you, anterior wall of the vagina, you can touch the clitoral branches structure. So, and how to palpate the G-spot? You can insert your finger inside the vagina like this, and by following this anterior wall and stay downward side of the vagina. Don't insert your finger completely inside. Try to palpate the urethra and go on the sides of the urethra 10 and 11 and other side 1 and 2. This is the area where you can palpate your G-spots, right and left G-spot. Okay. Vaginal pH level, that is another important thing. Vagina has its own ecosystem, and that ecosystem is a very healthy ecosystem, which our vagina is creating actually. So that is responsible, the functional vagina. So, as I told you, that whole vagina is highly vascularine. Too much of blood capillaries are present into upper 2/3 part. And these particular capillaries and blood supply is responsible for making the mucosa of the vagina to become more active. We don't have glands present inside here into vagina. No glands are present. So the secretion is not coming from the glands. The secretion is coming from the vaginal itself mucosal structure. And into this upper 2/3 part, we have this bacteria on the sheath of the mucosal layer. The bacteria is living, and this bacteria is very, very healthy bacteria, which our vagina requires. So this lactobacilli, healthy bacteria, lactobacilli present inside the vagina in upper 2/3 part. And this lactobacilli produce lactic acid. So they keep producing lactic acid. The droplets is present inside the vagina. And this lactic acid is responsible for making a good environment inside the vagina, which will kill the harmful bacteria. And in this part, the healthy bacteria can survive, lactobacilli can survive, but unhealthy bacteria should not survive. So this is what we are calling it as a pH level. So the pH level, vagina has its own pH level. And into that pH level, good bacteria can survive and bad bacteria cannot survive. And that pH level is present on upper 2/3 part of the vagina, not the lower 2/3. Okay, more upside, more inside, you will go inside in the vagina, more healthy that this bacteria is present, ecosystem is present. What is this pH level actually is? So let's understand. You might have heard about this, that vagina is having a pH level 3.5 to 4.5. It's not 4.5, it is 4.8 actually, but it's okay, 4.5. So what it is, this pH level? So if you understand the pH level, we can divide that from 0 to 14. 0 is highly acidic and 14 is highly alkaline, highly alkaline. Highly alkaline means all the bacteria, virus, they can, survive and they can damage the tissues. Very, very alkaline. And highly acidic means not even any bacteria can survive. All the bacteria is gonna kill because pH level is very high. Acidic environment is there, and because of the acidic environment, all the bacteria will die. But we don't want every bacteria to be die. We want some bacteria to sustain, which are good, and we don't want bad bacteria to grow. So our body requires some healthy bacteria. So if we understand the vaginal ecosystem, so the 7 is the neutral part, is the mid part of 0 to 14. 7 is the mid part. So now vagina don't want alkaline nature, because if alkaline nature will happen, the growth of the bacteria will be there. Bad bacteria will also start developing. We don't want alkaline vagina. We want acidic vagina. So we are going to move towards the acidic side, not the alkaline side. What is alkaline? Blood is alkaline. What is alkaline? Semen is alkaline. Sperms are alkaline into nature, not the vagina. Okay. So now we need, we don't want too much of high acidity, and we don't want too much of alkaline. So our vagina is going to create a system which is approximately in the midway, around 3.5 to 4.5. So that's the midway of which is vagina is somewhere acidic and somewhere alkaline also. It's not too much of alkaline, not too much of acidic. It means some bacteria can grow and some bacteria cannot grow. So means healthy bacteria, lactobacilli, can grow into this 3.5 to 4.5. And all unhealthy bacteria can't grow. So that's why we required that safe environment where our healthy bacteria can grow. So 3.5 to 4.5 is the right pH level which should be there in our vagina. And our vagina is maintaining this, our vaginal ecosystem is maintaining this healthy pH level by secreting by producing this lactic acid. So now whole vaginal mucosa will keep producing lactic acid, and this lactic acid is gonna maintain the pH level. And in this pH level, lactobacilli will develop. Okay, and lactobacilli will keep again helping in maintaining the good environment inside the vagina. And unhealthy bacteria will not develop because we have acidic vagina. Okay, so that's how our vagina upper 2/3 part is having this kind of pH level. And as you will go more downward towards the openings, towards the vestibule, the less presence of the lactobacilli. And the ecosystem is not that much healthy, how much it is more inside. Because internally, this particular part is going to come in connection with the cervix. And cervix is the door. And through the cervix, after the cervix, the uterus is going to start. And after the uterus, fallopian tubes are there. And then we are having our primary reproductive organs, ovaries are lying on the sides. So we don't want any bad thing developed near the cervix. Any bad bacteria develop near the cervix. If they will develop, they will infect our ovaries. And in our ovaries, we are having our eggs preserved. So we do not spread the infections towards that. So that's why our whole body is designed in that way. So more safety is provided towards the openings of the cervix. So vagina is more good, ecosystem is more developed into upper 2/3 part. Did you understand this, all of you?
Yes, ma.
Okay, so now, but this particular ecosystem and this pH level is again under the effect of hormones. There are some stages in our life when the pH level of the vagina is going to shift. Like what can create a shift into this particular region? Look, if my vagina is healthy, nothing is going on. It's just my vaginal fluid. So vagina will be healthy. But assume that other fluids are coming. What is other fluid? Like from uterus, blood is coming. So what is the blood? Blood is alkaline into nature. So whenever we are into periods and the cervix is open and blood is coming, blood is gonna pass through the sheath, and the blood is going to change that pH level of our vagina. vagina. So the whole vaginal sheath will become alkaline in that particular 4 to 5 days because of the presence of blood inside. So because blood is alkaline into nature, so that alkaline sheath will develop. So that's why during the periods, our vagina is not acidic into nature. It means vagina is more prone to develop infections at that time. Unhealthy bacteria can grow because vagina is neutral, 6 or 7 as per the pH level of the blood. So that period cycle, that particular 4 or 5 days of periods can affect our vaginal mucosal, vaginal ecosystem. Another thing which is going to affect our vagina, another phase, is the ovulation phase. Because during the ovulation, estrogen and progesterone release will be there, and progesterone responsibility is creating opening into the cervix, and by secreting lot of hormones, effect of the hormones, the effect of the hormone is going to create the thinning of the cervix, cervical fluid, and that is going to create lot of activation of the glands which is present into the cervix. So glands will keep secreting lot of fluid from the cervix, and that liquid is going to come down towards the vagina, because that is the liquid, some kind of discharge. So that discharge, as per the gravity, will come downward, and as per this discharge, again the discharge is going to create a alkaline environment into the area. Because vagina, this after ovulation, egg is waiting. So what body requires? Body wants sperm. So body is gonna create that change in a female body, like in the female system, so which is feasible for entry of the sperm. So cervix will be open, as well as lot of the glands which is present around the cervix, they will be more functional. They will keep secreting lot of fluid, and that fluid is alkaline into nature. So fluid will come towards the vagina, and that is going to create a shift to the vaginal ecosystem, vaginal alkaline pH level. It will become more alkaline. And another thing is why the shift is creating, the body is creating shift into the vagina, because body wants sex. After the intercourse, the sperm will enter, and sperm, if the vagina will become, will be acidic, so vagina is gonna kill the sperm, and the sperm is alkaline into nature. That the level of the pH level of the sperm is around 6 to 7. They are again alkaline. So if vagina is acidic, they will kill the sperm. So the shift is going to happen during the ovulation time. The vagina ecosystem is getting, pH level is getting changed. And the change is because of the cervical liquid, cervical secretion. Okay, and that is the need of the body. So the semen should survive, the sperm should survive, and sperm should move, more of the sperm should be live and go towards the egg. So body can get fertility, fertilization can happen, and pregnancy can happen, because this is what we are calling is a reproductive life from this, starting from the period. Body wants to reproduce. Every month body will create an environment. Every month body will release the eggs. Every month body wants to do this kind of change into the vagina, and the vagina will be ready for this penetration. Even those sexual hormones will also come into our life during the ovulation time period. So more sexual hormones will be there. Female will more attracted towards the male during that particular one day. So the sperm can enter the body, and if sperm is entering, the vagina is collecting the sperm, the semen, and the sperm should be survive, and sperm should be moved towards, after moving, this leaving the cervix, sperm should move towards the fallopian tubes, where our egg is waiting for fertilization. So this shift is happening during the periods into pH level, and the shift is going to happen during this ovulation time period also. So these are the two phases in our life, in our monthly cycle. Not only these two phases, the third important thing which is going to change the pH level of the vagina is the semen. Whenever in our days, or when in our life, in our monthly, in our life, whenever ejaculation of the semen is present, semen is gonna produce the alkaline sheath into the vagina, because semen is alkaline into nature. So they are going to shift the acidic environment. They are going to create an extra sheet on that particular vaginal layer. And this semen, whatever the level of the sperm will be, the sperm can survive in that particular area. So vagina should not be very active, acidic, which can kill the sperm. So that's how this semen is also responsible to change the pH level of the vagina. So girls, every time, whenever we are having sex and whenever there's an ejaculation is going to happen in our vagina, the ejaculation is creating a shift in the vagina. So our acidic environment is going to change towards the alkaline environment. So during having the sex also, we are more prone to have infections. So it's better that this is why we are always saying that we should have we try to preserve your vagina ecosystem, try to maintain your pH level 3.5 to 4.5. We cannot preserve that bleeding which is coming out from the uterus during the periods. We cannot even stop the ovulation. That is important. Periods are important, but we can always stop the effect of this ejaculation unnecessarily. So in other phases of our monthly cycle. So why unnecessarily create a shift in your acidic environment, in your good environment? Why to change your pH level? So ejaculation is going to change your pH level. So that's why we are saying that have sex with condom. Having sex with the condom means all the semen will be collected inside the condom, and our vagina will stay acidic at the same level. We can maintain the acidic environment of our vagina. So that is important, that use condom and try to avoid ejaculation inside the vagina unnecessarily. Or if ejaculation is there, then you please just wash yourself after having sex. And even wash the male genital wash is very, very important before having a sex also. So there should not be any unhealthy bacteria should be present over the penis, and that bacteria can directly go to the vagina and they can unnecessarily develop the problems inside. So this is what is the pH level. So which keeps vaginal pH level 3.5 to 4.5. So all harmful bacteria and virus cannot survive into acidic environment. Vaginal pH level increases during periods up to 7, means less acidic because of lactobacilli, and because of this less acidic environment, lactobacilli will be killed and they cannot survive in this one. And because lactobacilli level will be reduced with bleeding, that's why women are more prone to have infections at the end of their cycles, and even during the sexual ejaculations, and even during the ovulation time period. So these are the 3 phases when they are going to change the pH level in the vagina, ecosystem of the vagina. We can always check our pH level with the cotton swab test, and the pH level should be normal, 3.5 to 4.5. This is a healthy. If it is more alkaline side, it is not good into this. But some females are keep telling this, no, I have infections. So because their pH level is more alkaline, and into that level, more bacteria and virus can damage the internal tissues of the vagina, and they can start damaging the cervix also. So maintain the pH level by creating the healthy environment inside. And this healthy environment is created by good blood supply. So always keeps the blood supply inside the vagina should be always good. So that good lactic acid production should be there, good environment should be maintained, and have sex with the condom. Okay, I want to ask here one question. Have you ever heard about vaginal washes? V-wash, vaginal wash, something you are using? Yes. So what is written onto those washes?
Yes,
That the wash with this and this wash is gonna maintain the pH level of your vagina. Is it? This is written. Have you saw
yes, yes.
this written?
Usually there is that.
Usually it
Yes.
is on the packets that use this wash and it will maintain the pH of your vagina. So how we are using
Yes,
those?
that's what is written.
Sorry? How we are using those?
Yes, they usually write it in too.
Yeah, so it is written. So how we are
Daily washing.
those vaginal wash? Are we using the soap? The wash is on our finger, and we are inserting that inside the vagina, and we are washing upper 2/3 part, and then we are washing it. Do we wash the vagina like this?
No, we don't.
We don't like that, isn't it? So
Then-
if we don't wash the inner part of the vagina, and only inner part of the vagina is having 3.5 to 4.5. And the washing the vulva outside, how the washing the vulva is going to maintain the pH level of the vagina. If you wash outside here, so washing outside, how it will maintain the pH level of inside? Are you washing inside? And that's maintaining the pH level? No, na?
No.
So these are the marketing strategies of these people, and they are making us fool. So we should never use those kind of unnecessarily. We should not believe on those kind of vaginal wash. You cannot wash the vagina with the soap. Vagina is inside. We never insert the soap inside and washing our vagina. But we are washing is a vulva outside, mons pubis, labia majora only. We don't even open the labia minora and wash the, we should not even touch something, the chemicals into the vestibule, because vestibule is also very sensitive. So like we can wash our face, we can put soap over lips. Okay, we cannot open our lips and wash that inner part of our mouth with the soap. We don't do gargling with the soap. So we cannot insert in something inside the vagina, the soap. So why we are believing on vaginal wash? So the vaginal wash name itself is wrong, and by doing this extra wash, you cannot maintain the vaginal pH level, which is present into upper 2/3 part. So this is again a myth, big myth, and the whole world is following that. I think the good clarity is needed, good information is required. So I request all of you to please spread the information, right education, educate the people, and this kind of marketing people are using us for their products, and many of our females are using those products on the vestibule, and they are having the dryness issues, itching, and they are getting rid of their body natural moisture is going to get off because of this wash around the vestibule, and this is going to create a dryness inside the vestibule into around the orifice, and those females are more prone to have lubrication issues and dryness issues and itching issues and those kind of, because the environment is not healthy. So do not fall into the trap of these marketing strategies. Don't use anything inside the vagina. Even don't do vaginal dashing, because vaginal dashing is also not good. Vagina is a self-cleansing organ, like our mouth is self-cleansing organ. We are washing our teeth, because the food is stuck there. We never unnecessarily use soap. Whenever we are doing the gargling, we are also doing the gargling with the water, simple water. So simple water is enough and sufficient. If you are doing the dashing, you are washing your vagina, that's a vaginal dashing. That don't use any liquid into that unnecessarily, or do the dashing with the simple water. Wash yourself only with the simple water, around the vestibule or around this vaginal orifice, and don't believe into vaginal wash. Vaginal wash like things are not exist, and we should not support that. These people are making us fool, and they know that we don't know. Actually, we don't have this clarity about our whole body. So they know that we don't know, and that's why they are using us for, and the sell is on a high, and the products are high selling products actually. And that's why you might have seen many of the females, they have dryness issues nowadays going on. Okay. And gynecologists some gynecologists, they are in a favor of using the vaginal wash. They prescribe that use vaginal wash, and no, we should not use it. And why the doctors are telling? Because we are going again and again to them and we are telling them, I have an infection, I have an infection. So no, they have to tell us that wash yourself and wash yourself with the simple water. But they're telling us that wash yourself with the soap. So washing ourselves with the soap means creating more dryness down there. So it's not good at all. So they should not recommend V-wash. If they are recommending the V-wash or vaginal wash, so they are doing harm with the women health actually, and women's perineal body and vestibular area. They're damaging the vestibular area. And if we'll use a lot of vaginal wash, so their clinical practice will increase. They will get more OPDs. So it is beneficial for them. And this V-wash and those kind of products, they have their share into that. They have their commission. That's why they are recommending those things. If they are recommending, a good gynec will never recommend you the V-wash. But some of them, if they are recommending, we should understand what is the intentions behind that. Vaginal wash term itself is wrong. We cannot wash the vagina. That is wrong. You can't wash that area with the soap. Okay, clear, girls?
Yes.
Okay, sometimes you might have seen, observe on your panty, there is some kind of fluid is keep coming out from the vagina. So is the fluid is healthy? The discharge which is coming is a healthy? And what is this discharge? So vaginal ecosystem, vagina has its own ecosystem. Vagina typically produce 1 to 3 ml of discharge every 24 hours to keep ecosystem healthy and lubricated. We don't want dryness inside. As I told you, don't use wash. If you do washes and you do dashing, that lubrication will go out and the moisture will be out also. You will create dryness. So vaginal discharge is very important to keep the vagina moisture. And this is normal. Healthy vaginal discharge, what kind of discharge is good? Clear discharge, whitish discharge. So always observe your panty and see what kind of discharge is coming from the vagina. If it is a clear and whitish color, so that is good. Okay, it can, once it will dry, it will turn a bit yellowish on drying. So that is a healthy discharge. The vaginal discharge, whatever is coming, is it's a mixture of many fluids all together, which is coming into the vagina. That is a secretion coming from the cervix. The glands of the cervix will keep secreting the lubrication, and as per the gravity, that secretion will come downwards into the vagina. That is a amount, the blood capillaries, which is supplying the upper 2/3 of the vagina, they will keep making new cells and amount of new fluid from this bloodstream. So discharge is coming from the bloodstream of upper part of the vagina. Vagina cells are like that new cells will keep forming inside. So cells that shed from vaginal surface. So it's that kind of mixture. Various substances made by the lactobacilli bacteria. So that discharge is also a mixture of this, and secretion from the glands around the vaginal opening. So Bartholin glands are present, so they will also keep secreting, and the secretion will come outside through this 4 and 8 o'clock openings, and that is a secretion from the paraurethral glands also. So all this is gonna secrete, and the collected fluid we can see into the middle of our panty. So now observe what kind of fluid is coming from your vagina, and then what is healthy and what is not healthy. That is what we can do by looking at the color of the vaginal discharge. It clear is always healthy, but if it is a whitish, completely white, it is again healthy discharge. And but if it is kind of yellowish green, red, pink, gray, different color is there. It's not clear. Okay, it's some other color is there. Yellow is there, green is there, red is there, pink is there, gray is there. So that is not healthy, and it means something is wrong inside. So in this case, please visit your doctor and take a right advice. The color should be always healthy color, clear color. And even the second thing which we have to look about is the smell. What kind of smell is coming out? The smell is also very, very important. So it's a very foul smell is coming, so which is not your smell, it's something different, because we know our smell since childhood. So if something else is there, so please go to the doctor and don't take it easy. Don't take it light. Another is the amount of secretion. How much is secretion is there? If too much of secretion is going on, it means something is wrong. It should be only approximately, as we told, 3 to 5 ml of the secretion throughout the day. So secretion should be there, but not too much of secretion, that you are keep using lot of pads in a day and the secretion of the pad is going on. It means something is wrong inside the vagina or inside the cervix. So you need a checkup. So amount, smell, and the color is very, very important. So the girls, which is important here is educate yourself about the vulvar care, your vaginal health, your clitoral health, your external genitals, understand them. And, education creates awareness, and you will be aware that what is good for you, what is not good for you. Okay, and the right care is very, very important. Ensure the good cleaning, that we should, keep washing ourselves. But what we have to wash, we don't have to wash vagina, we have to wash vulva outside, labia majora, minora, because the fluids are keep coming out, not the fluid from the vagina, fluids are coming from the urethra also. Every day we are going for urination 5 to 6 times. So every 5 to 6 times, some droplets of urine will be always there. That will give smell, that will, the fluid of urine, the fluid of vagina, they will collect, they will mix together, they will create a wetness in our panty. Wetness is a source of infections. So bacteria can start developing there. So it's better to always wash yourself after every urination, but wash with the simple water. Don't use water. Don't use chemicals around the vestibule. But yes, you can use the chemical. You can use a simple mild soap, like the soap which you are applying on your face, gentle soap around your vulva where your hair is present. Okay, around there you can apply soap, but don't open up the areas, don't open your vestibule and apply soap there. Don't insert the soap inside the vagina. That is not good at all. It's not a good idea. It's a good idea to avoid perfumed soap, gels, and antiseptics, as this can affect the healthy balance of the area into vestibular region. Because a vestibular region also has the epithelial cells. They also have a different pH level into the vestibule. So don't damage the pH level of your vestibule. Don't insert anything inside the vagina. Some people, they do that washes with the antibacterial solutions, antiseptics. They wash their vagina with antiseptic. I also do advise that, but that is only healthy when you have infections going on. So infection is already there inside the vagina, then you can wash yourself with the antiseptics. But if there is no infection, you have a healthy system, don't use anything inside the vagina. Okay, it's not recommended. Women are advised to use plain water, I will say plain water over the vulva, and don't wash the vagina. Okay, and keep lot of washing during the periods. Whenever you are changing the pads, first wash yourself and then change the pad. Whenever your urination change, please wash yourself, and after wash, when you're washing with the water, don't forget to pad dry, because the droplets of the water should not be there, because that will create a unnecessary wetness, okay, in our panty. I will also advise you, if you are going outside for throughout the day, whole day, so please use panty liners, and keep changing your panty liners after 3 to 4 hours. Okay, so that will be a good, that will also maintain the good healthy system in that vulval region. So that is also good. So wash yourself and even pad dry, and try to use panty liners when you can't wash, when you are outside your house, when you can't use that water to wash. You can't sit down in the public toilets. So always have this what we are saying is use this panty liners, and always keep some wipes in your wet wipes, baby wipes, that wet wipes through the tissues, wet tissues through which you are taking care of your babies. So all the tissues, baby tissues, which you can apply on the skin of your baby, same tissue can also apply on your skin. So then we are cleaning our baby bumps, after when they are passing the stool, and so we clean them with the baby wipes. So we can also clean ourselves with the baby wipes. So when you are going outside, you can't sit down on this kind of commode, because they are the public toilets. So you can go urinate, and after that wipe yourself with the baby wipes. They are safe like to go, and they're healthy also. But you can always choose that those baby wipes should not have that kind of scent and perfumed and chemicals involved. Okay. So, and the direction of the wipe is also very, very important. How to wipe? It should be always front to back. Don't drag the wipe from back to front, because if you drag the wipes from back to front, might be some stool particles are there, might be some vaginal fluids is there. So if you back to front will drag the vaginal tissue towards the urethra. So the vaginal fluid will come towards the urethra. You might start having infection around the urethra, or the rectal tissues can come towards the vagina. You might start getting vaginal infection. So always front to back is the right direction. And after your that wipe, they should be pet dry. The very, very important thing is that change your panty frequently. If possible, 3 times in a day. Every 8 hours, we should change our panty. And because we should not have this kind of wetness down there, and try to prevent yourself from unnecessarily bacterial infections and those kind of irritations down there. The structures are very, very sensitive. One thing which we all are missing, that we should always try to wear light color panty. If you wear light color of panty, the panty itself will show you that what kind of fluid is coming out from your vagina. Dark color of panty, we might miss some fluid color, and that might give us, we might get it late when the infection is already spread. Okay, so your light color panty will always tell you. Every day we are changing the panty, we are using the panty. You look at your panty, what kind of discharge is coming out. If you saw it's a wrong discharge, you please go and visit your doctor at the right time. Don't delay that. Okay, so prevention is always better than care. And the panty which we are using, that the cloth of the panty should not be synthetic, because synthetic cannot soak the fluids which is coming from inside. If it is a cotton will always keep soaking extra fluids, and the area will be kind of healthy into this area. Okay, so wear cotton panty, and not a very tight thongs and tight panty. We need air circulation. It should be the good size of the panty, not very loose and not very tight also. So good loose, not very loose, but kind of right size. And cotton panty and light color panty, and keep changing whenever you are changing your clothes. You are going outside, you came from your work, you are changing your work clothes, same time you change your pants. And at night time, you are changing your night dress, again change your panties. So please invest in the panties and light colored panties and good clothing of your panties, cotton panties, no synthetic. That is going to preserve your inner structures. Sometimes vaginal dashing is one particular way to wash the vagina with water or some kind of antibacterial solution. Some females, they do vaginal dashing, but don't do vaginal dashing unnecessarily. If you don't have any unhealthy structures, don't have any irritation, don't have any infections, don't irritate your structure, don't do dashing. Okay. But yes, if already there is infections going on, burning inside the vagina is going on, you are having sex, and after having sex, there's a pain, you are feeling the pain inside the vagina, some kind of lacration is going on inside the vagina, lacerated skin is there. In that case, we can go for vaginal dashing. That is advisable. And sometimes if the infections are there, you can add some antibacterial solutions, and then just do dashing, wash the vagina, and the antibacterial sheath is going to kill the harmful bacteria. So that will help you. And the second is, if you are those kind of female who are more those kind of prone to have pain after the sex, you are having a sex, and after that you have some kind of pain and burning sensation inside the vagina. So what we can do, we can wash ourselves with the icy water. You fill the ice water into the bottle and wash your vagina with the ice water, because ice is good for your just to decrease the inflammation. So whenever you feel that there's an inflammation going on inside the vagina and burning sensation inside the vagina, so we can also wash our vagina with the chilled water. And that is the only two cases when we should wash it. Otherwise, avoid it. Okay, if you have a healthy system, don't irritate it unnecessarily. Okay. So this was vulvovaginal health, girls. All right.
Thank you so much.
So did you understood your vulva and your vagina and the health?
Yes, yes, really. You said you are going to talk regarding the vaginal steaming today.
Yeah, yes.
Yeah.
So let me just first go through the question answer, and then I'll also tell you how to do vaginal steaming. How vaginal
Okay.
steaming is very, very effective, but let me go through the questions first. Girls, what is the role of pelvic floor muscles? For that, you please join my sessions of pelvic floor, then you will understand. Pelvic floor do contractions around the vagina and relaxation around the vagina, and the action, the function of the pelvic floor is different according to the different stages. The problem is that some health professionals are promoting, yes, you can understand why they are promoting. Some people will say they have medical doctor in their marketing team and they recommend, and so many people will keep posting testimony. No, don't fall into that trap. That is a trap. Why they're promoting actually, so it's not healthy at all. Is there any aphrodisiac, maybe food that prevent this vaginal dryness or maintain the vaginal pH level? Probiotics. Eat lot of yogurt. Yogurt is very healthy for you. Eat lot of berries, strawberries, raspberry, all the berries, they are good for your vagina. So berries are good, as well as the yogurt is good. So, and some seeds are like flax seeds are there in the market. Flax seeds are very, very healthy. So which is high into estrogen. The seeds which are high in estrogen, they are good for your vagina. Okay. Thank you so much, Dr. Yusuf. Thank you. Asking about operations to increase the tone of vagina. Is it right? Look, if there is some kind of surgeries are going on and they are saying that they will increase the tone of your vagina, vagina is a smooth muscle. We can never increase the tone of the smooth muscle. When the smooth muscle is lax, it is lax actually. It's only the food and the collagen injections. If you do the collagen injection inside the vagina, so the tone, the temporary tone, like we have this nowadays Botox. So same way you can do the Botox injection inside your vagina and you can have this kind of swelling effect. Like we can have a swelling effect on the cheeks. So that kind of swelling effect you can have inside your vagina, and they're gonna give you that grasping sensation during sexual intercourse, but they are temporary. Every 1-2 years you have to go for Botox injections, and yes, you can go for it. It is up to you. That if you can afford it, you can go for it. But they are not they cannot increase the tone. They increase that temporary toning for some time. Okay. And anything which is telling that they can repair the collagen. Okay, collagen repair is there. So those kind of chemicals or those kind of medications you can try. I'm not saying that don't try, because collagen we can increase the collagen effect. How safe is the collagen injections? Like depending upon, they are like nowadays everyone, it is into the fashion, and I don't think that injections are safe. When you're taking something out from the outside, that is gonna give you some side effect today or tomorrow. So I'm not in a favor of that, but it is people's personal choice. They can go for it. Ma'am, is it safe to use panty liners daily to keep dry? I'm not saying you to keep dry. I'm telling you that panty liners will use when you are going for long trips. So otherwise, what is safe is just simple change your panty. But if you are on a long day out, so please use panty liners, because whenever I am going on my flights, I have a whole day to spend. So I try to use it, and they are more good and safer. You can throw it out, and you can keep yourself more healthy, because we sometimes we are not washing ourselves also at outside, so in a public toilets. So wipe yourself with the baby wipes and then throw the old panty liners. So keep frequent changing of the panty liner. That is safe, but not regular. I'm not saying regular use it. So whenever you are day out, use it. Some doctors suggest we wash for just few days till infection cures. Is it okay to use it and then wash with water immediately? Yes, you can always wash your vulva with a V wash. Vulvar wash, if that is the right term, okay, wash your vulva, but don't wash your vestibule. Okay, no, vestibule wash is not healthy at all. Please, can we use supplements containing estrogen to improve our vaginal dryness and sensitivity? Yes, doctor, we can use it. Estrogen is good for your vagina. It is good for our body, our skin, our tone, everything. It is good. Can you repeat the position to see the pubic angle? Position, you can just lie down and put one pillow beneath the knees, actually, bit elevation of the knees. Okay. So please place one pillow support beneath the knees and then bit abduction of the foot and then check. I'll show you the position. All right. So let me share. Be with me. I'm going to share one. Girls, you can join me in women health sessions. They are a whole complete 52 hours of learning program I have. Just be with me. I'm just checking it. Yes, what we can use on the perineal area, okay, around your mons. If you have a pain, you can apply cryotherapy. Okay, you can apply icing. You can apply ultrasound over your mons pubis. So this is a mons pubis. If the pain is there, you can apply that ultrasound over here, 3 megahertz, okay, for treating acute perineal pain, persistent perineal pain, and any pain which you are feeling around the mons pubis region. And this is the vaginal steaming. This is how we have to go for vaginal steaming. Vaginal steaming is direct. You can only take steam of simple water, or you can also add some kind of herbs into that water and boil the water and lie down. And you can place the same steamer, the facial steamer, you can place between your legs here, and then you can cover yourself. But in this way, it is then there might be chances of burning, so it's not a good position. So this is not healthy and good position. What is good is that have a this kind of stool which is having a one hole in the between, and you can place the steamer inside and you can sit on it, or just sit down on the commode and in your bathroom on a stool, and take a steamer and between your legs, and sit down and cover yourself with the blanket or towel and let the steam go inside your vagina. So this is again a good way to have the steam. Okay. I also want to share something. Yes, okay, it's done. Please, any dietary advice for a premenopausal women to induce maintain estrogen level? If you want to increase the estrogen level, so take lot of animal products or dairy products. Okay, that is good, because the animal products, they already have the estrogen. So you can consume direct estrogen. You can have a estrogen based seeds, which is available into the market, like sunflower seeds, flax seeds. They are high into estrogen, and like seeds and animal foods, they are high into estrogen. So premenopausal women should consume that, or direct hormones. You can have the estrogen-based hormones, the pills, medicines are also available. So you can go for estrogen-based medications. What role can physiotherapy play post-episiotomy to facilitate healing? Hi, dear, you please join me in postnatal session because that is again a big topic. So I can cover into that. Steaming is good or not when there is itching? It is good when there is itching. If itching means dryness. So means something is not good in that some pores are blocked. So steaming is good. Steam is gonna open the pores of your skin and the glands, and they will increase blood supply also. Glands will be more functional, more active. They will produce more liquid. The liquid will come outside. So it's always good. Okay, everyone. I hope you enjoyed the sessions and you had the depth of vulvo-vaginal health. And any question, the group is still open. You can write down into that. And the girls who have joined me into vulvo-vaginal health, you can, always keep asking me questions. So no problem into the group. There is another girl who have joined me in the complete women health physiotherapy sessions. So I will make another group and you join yourself. You can in that particular group, okay? Because in this group, there is all combined people were there. Thank you so much, everyone. I hope that I gave you some understanding. What is the duration?
Thank you so
Duration
much.
of this is approximately 10 to 15 minutes, till the time you can feel the steam fumes. Okay, so 10 to 15 minutes is good to go for steaming. And sitz bath is also a good option. If you're not comfortable with the steaming, you can go for sitz bath also. Fill a big tub with the hot water and you please try to dip yourself. That is also gonna improve the blood supply, gonna activate your glands, their functioning, and then they will open up the small blocked pores if there is any, and they will improve the lubrication. Thank you so much, everyone. See you next time. And my next topic is sexual health. So we will discuss about the sexual health in our next session. Bye-bye. Take care. Look after yourself. Love yourself. Do aware.
Thank you.
Keep learning. Keep spreading the awareness. Keep educating the women, because many women, they are not aware about their own body. So
Yes.
we can help. Gynecologists will never help because they will never create education awareness, because if they will create awareness, that we will not become patient. And if we will not become patient, we will not go to them. Okay, it is their bread and butter.
Yes, sir. Thank you so much, ma'am.
Thank you so much.
Thank you so much, everyone. Thank you. I will share my Facebook page link. Don't forget to put your review or your feedback on my page. It will be very helpful for me. Thank you so much.
Thank you.
Bye, Dr. Sunita.
Thank you very much.
Bye, colleagues.
Hi,
Bye.
Dr.
Bye.
Jane.
Thank
Bye.
you.
Bye-bye.
Hi,
Bye.
Dr.
Bye,
Jane. I'm happy
everyone.
to have you.
Bye.
Bye, bye. Bye, dear. Bye,
Bye.
Dr. Saratu. Bye, Dr. Saratu. Bye.
Yes, bye, my.
Mhm.
Thank you so
Ma'am,
much.
do we have a session tomorrow?
Yeah, we will have puberty tomorrow.
Okay, ma'am.
Yep. All right, girls. Bye-bye.
Bye. Dr. Sunita always looking the same. Do you get old at all? Do you get old at all? Always looking young.
I'm getting
Say
older
bye.
now. I'm going to turn 43 on 2nd of January.
You mean it.
Same
Bye.
age.
Mhm.
Bye-bye, girls. Dr. Rohini, I'll see you tomorrow session in puberty. I'll see you in tomorrow's session. Bye, everyone. See you. Take care. Look after. Bye.
Bye.